Fruit is a sugar bomb. Sugar is addictive. It's poison. If you've been on social media lately, those headlines are impossible to avoid. And for many of our patients, they're downright terrifying. But here's the thing. These messages aren't just sensational, they're misleading. And when patients start cutting out entire food groups like fruit, or when they come into the exam room thinking sugar is just as dangerous as alcohol, we've got a real problem on our hands. I'm Colleen, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. Today, we're unpacking the sugar panic with someone who knows how to separate evidence from emotion. Dr. Dustin Moore is a public health expert, educator, and scientific communicator with a PhD in public health and a deep passion for nuance in nutrition, and he's here to help us cut through the candy-coated chaos. In this episode, we dig into what the actual definition of poison is and why the dose makes the poison is the phrase every clinician needs in their back pocket. He shows us a helpful teaching strategy to compare sugar to things like water, snake venom, and chocolate to teach patients that context is everything, especially when it comes to toxicity. We'll talk about whether sugar is truly addictive and how it compares to substances like alcohol or hard drugs. We also share how to respond when a patient says things like, "Fruit is bad for you," or "I'm avoiding all sugar." And finally, Dustin shares a smart strategy for uncovering when patients are drinking far more sugar than they realize. It's a powerful reminder that how we ask questions matters just as much as what we ask. And real quick, I wanted to thank Learning as a PAS on Apple Podcast for leaving me this review. She said, "Colleen makes the information digestible and applicable and gives excellent tips for counseling. Her emphasis on meeting the patient where they are is extremely valuable, and her guests are always knowledgeable and excellent additional resources." Thank you so much for that. And if you would agree, could you take 2 minutes and leave me a review? I am deeply grateful for any and all feedback. All right, now get comfy or drive safe and enjoy my conversation with Dustin. Dustin, thank you so much for coming on to the podcast today. I can't wait to get into this sugar panic with you. Welcome to the show.
Thank you very much for having me on, Colleen.
So we've connected on LinkedIn, and you recently posted an article on your Substack that was talking about sugar being poison. And I loved that article. So I had to have you on the show to unpack this whole, topic of sugar and if it's really poisonous to our body. So I want to unpack that word because it's being thrown around like crazy. So from a toxicology standpoint, how is poison actually defined?
Okay, so poison is actually defined in fairly generic terms, just according to whatever organization that you look at, even toxicological organizations, the CDC, the WHO. Everybody kind of has their own way that they spin it, but specifically, they always describe it as any substance or item which causes harm to the human body. Which automatically, you hear that, I hear that, and I think, well, that's not very specific because there's a lot of things I could think of that are going to be basically fulfilling that definition, like too much sunlight, too much of a certain nutrient, binge watching too many episodes of Love Island. All of those things you could arguably say are going to be harmful on the person. So that's what everybody generally says, but organization-wise, they all have their own spin on how they do it. Like, for example, the WHO says any substance that can cause harm to a living organism when introduced in sufficient quantity to an organism, or the CDC, which describes it as saying poisoning or injury occurs anytime that you have inhalation, absorption, ingestion, or injection of a specific substance. So they talk about like route of administration. So everybody agrees that, yeah, it's something that causes harm to the human body, but they all kind of dance around exactly how they contextualize that.
Yeah, and it's just been thrown around like crazy lately. It feels like if you go online, like everything is poisonous to our body. Whereas like maybe 5 or 10 years ago, we didn't have that terminology. We weren't labeling foods as poison back then. So another thing that scientists are sharing to kind of combat this misinformation is that the dose makes the poison. So I'd love your thoughts on if that is true and how does that factor into whether something is harmful or not?
Absolutely. So, take for example, like vitamin A. Like vitamin A is a critical vitamin that's needed for a whole bunch of functions, for DNA synthesis, for skin cell synthesis, for your immune system to operate. But if you get too high of a dose of vitamin A, there's a toxicology to it. It causes liver damage. It can shut down your liver in high enough doses, and it can even lead to death. So, we absolutely do agree on this point that a lot of things which are necessary, which are beneficial, but just getting too much of it is going to ultimately just cause a problem. There's another detail related to quantity, which is really cool in terms of like how you measure and assess the toxicity of something. And we call that the LD50. So you have toxicologists who run this test where they take like a population of like mice or rats or something like that, and they will administer a dose of a substance based on, the body weight or something like that, like 1 gram per kilogram. And if the substance, whatever amount of that substance will kill 50% of that population, that's what they said is the LD50. So for example, I could say that my LD50 for substance A is 100 milligrams per kilogram of body weight. And if I take that and if I give it to every single rat, and if it kills half of the rats in my test sample population, boom, I've got an LD50 for it. So we can quantify various levels by which we say like, oh, this is how toxic a substance is. So for example, like the most toxic substance I think that we know of is botulinum toxin. It's 1 nanogram per kilogram of body weights. Nicotine, which is up to, I think it's 50 milligrams per kilogram of body weight. So you get a sense about how like, okay, we can measure toxicity in real time using actual data from something like that. But it is almost always based around how much of a dose are they getting that causes the toxicological symptoms.
Yeah. And I think it's important that we always come back to that because these influencers that are just sharing this misinformation are often taking some of those maybe studies that they are citing way out of context. And then they're trying to extrapolate it and relate it to, the typical dose that humans are eating, which is nowhere near what they maybe studied or what they're looking at in the literature. Okay, now in your article, you gave some really cool examples of water, snake venom, and chocolate to illustrate how context actually changes toxicity. So if you can unpack that for anyone who hasn't read it, and for those of you who want to read this article, it will be linked down below in the show notes so you can take a look at this full article that we're talking about today. But why is it important that we apply the same nuance when we're talking about sugar and if that's poison or not?
Okay, so in terms of like the examples that I use, like for example, water, I defy anybody to try to tell me that water is not good for you. Like, please go out and make that argument however you want to. But if you consume too much water within a certain time period, you're going to experience symptoms of hyponatremia. You're going to thin out the electrolytes in your blood. It could cause brain damage. It could cause heart failure. All of that can occur as a result of excessive water consumption. We've even seen deaths that have occurred from that. The snake venom example, I thought of this one because I was on a trip recently up in the mountains and we came across a rattlesnake. If you were to take snake venom and if you were to drink it, it wouldn't do anything to you. And the reason being is because snake venom is a cytotoxin. Its effects work only when they're exposed to blood, inside the blood or injected into the blood. Now, not exactly like you should go about drinking snake venom, but just, just a point of FYI that that's not how it would kill you or how it would work on you. And then the subject of chocolate came up because human beings, all of us love chocolate, all of us adore chocolate. But compound wise, if you were to administer that to a dog, there's a specific compound within it that shuts down an enzyme that dogs need, and that could cause lethal outcomes or could kill the dog or something like that. So, subject, administration, dose. Those are all things, those are all points of context and nuance when you're thinking about poison. And to your other question about like how do we or why should we introduce this into the context of, the discussion about sugar, it's because everything becomes a poison if you don't apply those limits or those boundaries to it. I already made the quip about Love Island episodes and sunlight, but to be more serious, like sunlight is a net good. I mean, there's all sorts of benefits that come from exposure to the sun, being outside. Exposure on your skin causes vitamin D synthesis. However, long extended overdoses of sunlight exposure will cause burns, and if you do that in excess, we know that that's related to an elevated risk of skin cancer.
That's why I love talking to dietitians because we actually do get into the nuance of things. And again, social media really doesn't. They're just so all about clickbait and fear mongering. And watch now, like snake venom shots are going to be like the new trend that's going to happen. So,
I hope you don't have a sniff. Anybody who tries that, you better not have a stomach ulcer, because if you do, then all of a sudden you're going to be in big trouble for that. So, ugh,
Oh,
yeah,
I know, but
do not advise.
it's just such a great example. I mean, all of those examples that you gave are so fantastic. I mean, that people can really understand. And I think as clinicians, that's how we should explain it. If they come into the office and are like, oh, but so and so influencer said that sugar is poison and I need to avoid all sugar. Use that example of sun exposure or use that example of water intake as okay, the dose really does make the poison. So I really love the nuance there and the examples that you gave. Okay, well, let's get into biochemistry class and get onto the subject of today, which is all about sugar. But I want to take us back to college, please, and remind us what is a monosaccharide, and then talk about glucose and what makes it unique.
Okay. Monosaccharide is the most elementary unit of a sugar. A monosaccharide is that specific single element that our brain, our tongue can perceive as the sweet flavor that we get and we pick up if we ever consume it or we eat it or something like that. Monosaccharides can be made up of anywhere from 3 to 7 carbons, but the ones that we consume, like glucose, galactose, fructose in particular, the ones that we ingest, those are 6 carbon chains, which have different functional groups onto them, which again just denote the level of sweetness that we perceive when we consume them. Now, glucose is a very special one because number one, it's the primary energy unit of the human body. Number two is when you consume any type of carbohydrate, everything gets broken down into the glucose units. So for example, like starches, or, you consume a potato or you consume corn, there's going to be glucose units that are bound up within these long starch chains. But as your body digests and breaks it and cleaves it apart, it breaks down into those individual elemental units that, again, get absorbed as glucose. And for those other two, whether it's fructose or galactose, those head over to the liver once they get absorbed into the bloodstream, and they are moved and replaced and isomerized into glucose units. So hail to the king. Glucose takes champ over all of them. And the reason being is because it's the primary energy source for the human body. You constantly have glucose coursing throughout your blood. It feeds the cells of your body. It's very critical for your central nervous system. And if it was to drop and if it was to go away, death would ensue if that were the case.
Yeah. Okay. So in your paper, you argued that sugar has not directly killed anyone. And then you compared it to alcohol and drug use, which obviously it has. But a common argument online and actually in one of your comments on your LinkedIn post on this article is that sugar contributes to diseases that do kill people, like heart disease, diabetes. So can you give us a response to that? If you are making this argument that sugar hasn't directly killed anyone, but then someone kind of goes toe to toe with us, how would you defend yourself?
Okay, so if I'm being facetious to the point, or if I think somebody's being insincere about it, then I'm gonna be fairly lighthearted about this and just kind of make the argument to say, okay, I live near Los Angeles. I drive through Los Angeles all the time. Unfortunately, have a lot of homeless camps and populations. How many people do you think that are on the streets right now are out there because they have some sort of a sugar addiction?
I would say probably none.
Probably none. Or if you drive past a really bad accident or something like that, you see a horrible accident and you're thinking, oh my goodness, hope those people are okay. Does it ever come to anyone's mind thinking, I bet they were drinking Starbucks drinks before they went out and they drove?
Probably not.
It's just not the case. And so I find it to be a very disingenuous argument to try to say that sugar kills people in the same sense that hard drugs and alcohol do. It's just completely irresponsible and completely unethical to try to make that kind of connection with it. But if I'm being more sincere and I'm steel manning the point about it, this is not a defense of just consume as much sugar as you want. The problem is that operative word of contributes to. The problem is how it's associated with all of these negative outcomes. So for example, ultimately sugar is energy, and excess energy, if not used or is collected and stored as fat in the human body. Excess fat, obesity leads to and drives to all these other conditions that, people can have: metabolic disorders, diabetes, MASLD, gout. All of this comes as an associative relationship to getting too much energy from sugar. And the point of it too is the fact that sugar intake in particular is just too easy to get. Like it is everywhere. Like if you want to consume like a beverage, a person can consume and down like an entire thing of soda, a sugar sweetened beverage, and then 15 minutes later they're like, oh, I'm hungry again. But they've already had all of the energy from it. So it's just, again, an easy way to access more energy to the human body, leading to those problems down the road that they could have.
Can we talk a little bit about addiction? Because that's another argument, I would say, that people kind of go back and forth on. And I would just love to hear your thoughts on the concept that sugar is addicting, or if you think that it is not. I'd like to just hear your opinion on that.
So, honest and sincere answer to it is I have read some research which has demonstrated that there is addictive like behaviors for some people related to sugar. So, people, for whatever reason, like they start to consume it and then all of a sudden they just feel like they have to consume it and they feel a lack of restraint or lack of willpower, however you want to characterize it. There's instances in some literature to show that. But that's not the same thing as an addiction. There's a big difference and a big divide between addictive like behaviors and an addiction itself. And again, going back to my tongue-in-cheek argument from beforehand, if you've ever seen an individual who's suffering on the streets, nobody is out there because of a sugar addiction. Nobody who gets admitted into the hospital where I work at, nobody is admitted there because they just cannot break away from too many sugar-sweetened beverages. So is there behavioral issues that might be associated with it? Maybe. I think there's some evidence to show that. But a full-blown addiction in terms of like warping the human body or warping or repatterning the neuroplasticity of the brain to be more dependent on the substance, no. No, there's not.
Sugar sweetened things are delicious. Like, they taste really good. So we all as a society enjoy those foods. And so a lot of the times, a lot of these sweet things that we consume are around parties or celebrations. And so we are also enjoying the moment with our community. And that all has an impact to, reach out for those things or to crave those things even more. And like you said, it's super easy to get like 60 grams of sugar from your favorite Starbucks or Dunkin' Donuts coffee drink. And so I think that is a really important factor at play too, is just the ease in which we can consume all of those excess calories from sugar. I love your thoughts on that with sugar, kind of surrounding us as a society.
I love that you bring this up because food is more than just nutrition. Food is cultural, food is social celebrations or other special events where the food is kind of just adding to the joy of the relationships that you have with each other. And again, you take that too far, or you just start making the food itself the joy, or you start making the food itself just like the point of pleasure or of action. That's where I think you start to get in a little bit more trouble with it. But you're completely right in the fact that you can't just treat food like it's solely for nutrition because it has such a cultural base that I think it's kind of a silly thing to try to tell people otherwise, that no, you can never enjoy sugar or you should never have any sugar whatsoever.
Yeah. I so agree with you that food is connection, and I'm all about connection during meal times. There's plenty of studies. I'm in the pediatric space. We have a plethora of literature that supports the benefit of family meals and eating with each other. And so I am all for that. Now, the people who disagree or who are kind of, I would say haters on dietitians will say that we all promote highly processed foods, sugar sweetened beverages, and we're just out here saying like, oh, everybody can just enjoy sugar. So I do think it's important that, as dietitians, we don't just have this willy-nilly like, oh, just enjoy everything. It kind of doesn't matter, because if we look at the population, it is obvious that we know there is an overconsumption of sugar. So have you looked at that? And do you know how much added sugar the average American is consuming? And then what are the limits and how far away are we from that?
So the current American is consuming about 13% of their calories from sugar. So if you take like all calories of individuals and you break it down by a percentage of their macronutrients, the population of the United States gets about 13% of its calories from added sugar intake specifically. And if you want to further subdivide and look at that, like what's making up that 13% of those calories, one of the reasons why we constantly target sugar-sweetened beverages is because, number one, they're such easy access, and number two, they make up a little bit more than half of those calories. So we drink in excess a lot of extra calories. And where you want it to be, the recommended limit is no more than 10% of your calories should be coming from added sugar. So operationalizing that for a person who has a general 2,000 calorie diet, that's about 12 teaspoons per day. For most people, that's about 48 grams. So functionally, because I always like to talk in functional terms, not just in like the research terms of like how we measure it. Functionally, that's basically a can of Coke or a can of Pepsi. Your 12 fluid ounce can is going to be about 39 grams of sugar in it. So if that's what you do for a day, you've pretty much just about hit what your limit is just on drinking one of those beverages, let alone like, a 20 fluid ounce or a big gulp or whatever other gargantuan size of a drink that you could get.
Yeah. Okay. For those who like citations, where did you get these recommendations from?
Okay, so those recommendations, that comes straight out of the dietary guidelines for Americans. So the 2020-2025 issuance, that's less than 10% of your calories should come from added sugar.
And I will link down to that below in the show notes if you wanted to read more about that. But that is kind of like our holy grail and our guidelines that we use. Now, I love that the guidelines broke out kind of where people are getting their sugar, their added sugar from, because it was really helpful to see that so much comes from our sugar sweetened beverages. And I think we can use that in the exam room as a great piece of education for patients and just sort of reflection for them is like, why don't you write down everything that you drink every day? Like, let's take a look there before we even go and drastically change your diet. We might be able to cut your calories, cut your total sugar intake by just swapping over to seltzer water or unsweetened tea. There's a lot of things that you can do to cut down on sugar just looking at a person's beverages. So I'm really glad that you brought that up.
Yeah, absolutely. And then there's actually one other really interesting thing too about like the amount that we're consuming. The trend has actually gone down like significantly. So we can look at like data from like the 90s to 2000 to present day. And what we've actually seen is that figure that I mentioned, which lies to about like 13% of our calories come from added sugar. It was closer to 18% in the 90s. So overall, the trend is going this direction. Clearly not to where it needs to be yet because we're not within that recommended limit. But I like to always look at the long term and kind of think about where have we been versus where are we going. And so for added sugar, at the very least, it's been going in a better direction, even though we're still not where we want to be as a nation.
Okay, so briefly, I think a lot of my listeners have an understanding of this, but I would like your take on which chronic health conditions are most strongly linked to excess sugar intake. And then I'm curious if you've ever looked at and if you know what the mechanism is, because we talked about how easy it is to consume added sugar, which just, contributes to the excess energy intake. And so is it weight gain? Is it inflammation? Is it insulin resistance? Curious your take on what really is the problem with added sugar intake.
Okay, lots to unpack from that. So I'll try to make this into as tightly packaged of a response as I possibly can. So the number one condition that is most closely associated with excess sugar intake is obesity. And in individuals who, struggle with obesity, as body mass accumulates, as fat mass accumulates, you start to observe what we would define as basically this low-grade chronic state of inflammation that people are experiencing, and these other changes in metabolic status, which we haven't exactly teased out the perfect reasons for why they're doing what they're doing. But the driving mechanism for a lot of those conditions, whether that's looking at type 2 diabetes or cardiovascular disease or MASLD, there's a condition that used to be called non-alcoholic fatty liver disease. It was the condition where you have accumulation of fat and associated inflammation in the liver when it has nothing to do with alcohol whatsoever. So the clinical world has said, why are we using a non-definition as a definition? That's ridiculous. So they decided instead to rebrand it as metabolic dysfunction associated steatotic liver disease, which is much more of a mouthful, but it's more to the point of what it is. So it's MASLD. So it's the exact same thing. It's just what they used to call NAFLD. They now call MASLD or MASLD for short instead. Okay. So the driver behind all of this stuff is weight gain. The reason why I say that is because everything else appears to follow the weight gain. So the insulin resistance, inflammation. Here's the thing about type 2 diabetes. We know it has very strong causal mechanisms related to obesity, but we don't know why. The central issue behind type 2 diabetes is the fact that that GLUT4 receptor inside of the cells, for whatever reason, when insulin comes around and it hits its receptor, it doesn't fit, it doesn't recognize it, it's not sufficient quantity, so that the GLUT4 transporter gets activated, brought up to the cell lining, and carries the glucose back into the cell where it's supposed to be. We don't know why that happens exactly. What is it about obesity that necessarily causes a loss of that function? But all we know is that this is always the pretext for it. It's always the weight gain first, and then you start to observe, like I said, that low-grade chronic inflammation. You start to observe that increasing insulin resistance where you require higher drive or a higher dose in order for the body to respond to it. We don't know why it does that. But there's almost always, I should say, weight gain that's associated firsthand. So that appears to be the driver to it. There was actually, I was trying to find, Colleen, there was a really, really fascinating study that was done years ago, which looked at populations and it's categorized them according to fat mass that people had gained. So they were controlled for in all other factors like body weight, lean body mass tissue, percentage, and things like that. But then it was able to categorize them according to how much fat mass they were carrying. And the study, and the way that it was conducted was brilliant because it functionally showed that there was a dose response effect for how much insulin resistance a population was experiencing, how bad their case of type 2 diabetes was. And you saw that it was functionally linear in accordance with the fat mass that was observed on these populations. So more of it that was accrued, more problems with hormonal operations, more problems with hormonal changes that are all associated with, type 2 diabetes. But then also you could find extrapolations to that on cardiovascular disease as well.
Yeah, complicated question that, again, requires nuance. There isn't a black or white, straight yes or no answer to this. And I also think it really depends on the individual. And I recently had a guest on the podcast. He's a PA, also a PhD he does Alzheimer's and cholesterol studies, super smart guy. And he has a mantra that says, control your insulin, control your life, because he studies cardiovascular disease. And so that episode was really fascinating look at the best, quote, diet to lower cholesterol levels. And we did talk about, insulin resistance is a driver also for cardiovascular disease. So for any of you who want to check out that episode, it would be a great one to listen to after this. It's episode 117 called What's the Best Diet to Lower Cholesterol? So we dig a little bit deeper into insulin resistance and its impact on heart health. Okay, Dustin. Now, you drew a distinction between added sugar and sugar in whole foods like fruit. And I think this is so important that we kind of tie the bow on this topic, because we also hear on social media kind of loops around over and over again. And it drives me insane when people say that fruit is a sugar bomb. And I've even had patients come in and say, oh, I'm trying to avoid fruit because it has too much sugar. So please unpack this and please defend poor fruit against this mantra that it's bad for us because it has too much sugar.
Okay. So where do I begin with this? There's not many things I hear online that anger me or annoy me, but there was one instance of, and I'm not going to reference who this was. I'm not going to drive any more content over to this individual, but there was an interview that this person was doing, and they were making a comparison about saying how you may as well eat chocolate instead of fruit. And he was referencing certain fruits. And the whole point of what he was making was they have the same amount of calories to each other. So, okay, let's just take that and let's run with that for a hot second here. So if I want to look at common various fruits or something, I could look at a serving of grapes, a cup of grapes, a medium banana, an apple, a cup of mango. It's anywhere from 90 to 105 calories that you get per serving in each of those. And if you're going to take your average chocolate bar, a really popular one like Hershey's or something like that, your average Hershey's chocolate bar, a single chocolate bar, is, I believe, about 220 calories. So on the one hand, servings per serving, they're not the same thing as each other. If you want to disingenuize that argument and just take 4 cups, 5 cups, I'm pounding 6 pounds of grapes at a time. Not actually that much. That's a dramatic example. So if you look at it that way, if you're going to measure it that way, then of course you're going to have a massive discrepancy in calories that are going to be provided by the fruit compared to anything else, like a candy or a treat or a chocolate or something like that. But the other very important point to get from that is, what do those calories deliver is the big difference. So what do the calories of chocolate deliver versus what do the calories of fruit deliver? Well, on the one hand, I can think easily. I get a lot more hydration with fruit. I get more mineral. I get more fiber content. I get more vitamin content. So they're not the same thing as each other. You cannot just reduce it down to a simple look at only the calories that are provided. That's nonsense. Calories are vehicles for these other items that we need in order for the body to function, to operate, and to thrive. So on the one hand, no, silly argument. On the other hand, you have individuals who will say that you can't consume fruit because it's the fructose. We don't like the fructose. Fructose gets picked on in particular. Fructose is the sweetest of all of the added sugars that we can consume. In the human body, there are some biochemical differences with how it gets handled and how it gets metabolize, but that's probably just outside of the discussion for today. But again, even if I take those examples and I look at them, I'm not going to find any comparable outcome with that versus like an ultra processed added sugar item. So like, for example, a serving of mango, that same serving of mango in 1 cup has about 4.5 grams of fructose in it. A banana, 5 grams of fructose. A can of soda, 21 grams of fructose. So they're not comparable to each other. And going further to the point, I've heard this argued is people who try to make some sort of an association between obesity and fruit intake. Fruit intake. We have a dearth of fruit intake in this nation. It's one of the major public health issues that we're seeing. Hardly anybody consumes fruit. Like on average, it's 0.7, 0.8 servings of fruit per day of what your average individual is consuming, which is way underneath the amount that we want people to be consuming. So no, we really ought to be getting away from this. Now, the fact of the matter is, if the fruit that you're consuming is the form of a strawberry Pop-Tart, then I'd say that's a problem. But just whole fruit in and of itself, even if it comes out of a can, even if it's been frozen, fruit, 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 fruit. We need to be consuming more fruit. And any of this messaging which tries to alienate it or just reduce it down simply to a calorie input is just a completely disingenuous argument.
That was so well said. I have nothing more to add. I just applaud that statement and I completely agree with you because it drives me nuts too. Like fruit has so many benefits. I mean, anti-cancer, they've got phytonutrients, antioxidants. They are just like God's gift to this earth. And it is so true. People do not consume enough of them. So we need to stop with the narrative that they're harmful to us. All right, let's wrap this up and bring it back to the exam room. Although you've given us some really, really helpful kind of talking points already throughout this conversation, I would just love to hear, how do you educate a patient, a client sitting in front of you who maybe has type 2 diabetes, who is at risk for cardiovascular disease? Maybe they already are having some red flags or are over-consuming sugar. How would we have a helpful, non-fear-based conversation with them to talk about sugar intake?
Okay, so central point of any good clinician, any good healthcare provider, my role is I don't tell you what you're supposed to do. I just give you the information. I help work through it with you, and I give you all of the options, and then you make the decision for yourself on what you want to do. In terms of the sugar stuff, basic elemental point, it's energy. I say, I want you to start ingraining this in your mind. You need to think of sugar as energy. And people will say something like, oh, it's just inflammatory. I actually just had a patient who I was working with, a very elderly woman who was very low body weight, had an injury we're trying to help her get back from. And I offered her to have an oral supplement, just one of the simple like protein drinks or nutrition drinks that we have. And she's like, I don't want to because it has too much sugar that's inflammatory. And I explained to her and I said, it's just energy for you. I said, in excessive doses, beyond like a healthy diet, maybe there's going to be some complications. But for you right now in this setting, your body healing, it needs energy to help rebuild itself. And the sugar that's going to be provided by this is just an easy way for it to get it. And I promise you that beyond helping you get out of this hospital, it's not going to cause a problem. So we've got to get rid of and we've got to get away from addiction and inflammation and metabolic dysfunction and all this other business, and just realize that in a moment, all sugar is just energy. If there's excess energy, it becomes a problem. But in the moment and within the proper amounts, it's not going to be a problem for individuals. So that's what I would suggest is just rule number one is for people and all their questions, just teach them that it's energy.
Yeah. Now, what if someone is like eating 100 grams of sugar and maybe they come to you asking like, how do I lose weight? Or, maybe that's the first place that you start. Do you offer swaps? Would you even suggest that? Or maybe helping them eat more fruit? Kind of how would you educate someone on maybe a diet that's lower in added sugar?
I mean, a very common one, which again, you'd always want to personalize this according to the patient that you're working with, but a very common one that I find all the time is added sugar intake from beverages. I mean, everybody has some form of it, and people don't even often realize like that's the case. So for example, like I'm talking to a gentleman who has uncontrolled type 2 diabetes. His A1C is like 11.3%. And we start talking to each other and he tells me about his diet. And, his diet to me sounds pretty good. It's nutrient dense. The whole grain intake, fruit and vegetable intake is all well and fine. But then I asked him about what do his beverages look like. I said, do you ever consume any sugar sweetened beverages? And he goes, well, what are those? And I said, well, that would be stuff like, soda, or that would be something like an energy drink. And he goes, oh, no, I don't touch that stuff. But then a couple of more probing questions. I say, well, what do you like to drink? He'll say, well, I'm a big fan of Gatorade. I like this one specialty drink from Starbucks. And I tell the individual, like, okay, well, that also is going to have added sugar in it. They don't know that. They don't assume that. And I mean, that's one of those points of knowledge that you just kind of take for granted of working as a clinician or as a dietitian, as a PA. A lot of things where you just cannot assume that what you have in your head is exactly what the patient is going to know in the moment. So asking those questions are an easy one. And like the added sugar one is an easy one. For people that I talk to where it's like, okay, I consume like 4 cans of Coke a day. And I start off and I say, can you make it 2? Can you make it 2? And can you replace some of those with like a drink of water instead? Telling them that instead of saying, no, you can't have any of this anymore is way more effective of a means for driving behavior change as opposed to, nope, stop, nope, cold turkey, nope, you can't do any of this ever again. So those little swaps are good. And the sugar sweetened beverage is a really easy direction to first start that with because most people are consuming too much of them.
Yeah, I agree with your counseling technique as well. I mean, even if someone going from 5, cans of soda a day to 2, that's a drastic change. That will prove
Huge.
beneficial for them.
That's 360 calories difference.
Yeah. They also will still have joy in eating and joy in life, and they will be more likely to stick to it. And I really, really I want this to be the take home point from this episode, how you went deeper and asked your patient probing questions, because you're totally right. What we as clinicians have in our mind, do you drink sugar sweetened beverages? In my mind, I'm imagining all of those things. To a 65-year-old guy, like my dad, for example, he's going to say, well, no. And I love that point is ask them a more open-ended question. What do you drink during the day? And just let them list it. And then you could determine if that Gatorade is considered a sugar sweetened beverages. So I love that point.
Yeah, know those specific examples and tell them. And like that checks it off because again, we always think in terms of like the data. We think in terms of research and these technical terms. Not everybody else does.
And not everybody realizes that like a sports drink, an energy drink has a lot of sugar in it too. So that is a great piece of education and a really wonderful take home point for people listening. So Dustin, this has been such a great, helpful conversation on whether sugar is poison and how we educate our patients about the topic of sugar. So thanks so much for jumping on and sharing your article. If people want to connect with you and find you online, where can they hang out with you?
Online, my most active social media platforms is LinkedIn and Instagram. And then I have a Substack, a newsletter called Public Health Dad that they can subscribe to for free and paid subscriptions.
Awesome. So I will link to all of that down below in the show notes. But Dustin, thank you so much for your time today.
My pleasure, Colleen. Thank you very much.
All right. Well, I hope you now feel confident in what to say when a patient tells you that they're avoiding fruit because it has too much sugar. Conversations like that are exactly why context matters, especially when it comes to nutrition. It all comes down to knowing the patient in front of you. A Gatorade, or heck, even a Rice Krispies treat, might be a smart choice for an athlete, but maybe not the best fit for someone trying to lose weight or manage their blood sugars. So ask your patient probing questions to go deeper. And always aim for small, realistic changes instead of massive diet overhauls. Now, next week, I'm switching things up on the podcast and making a huge announcement. So stay tuned. And be sure to click the follow or subscribe button in your podcast app so you never miss an episode. And as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.